overview of this behavioral treatment. We're going to identify that function. And again, it can be multifunctional. And then we're going to think about the environment and can we modify anything to help and reduce triggers and stress. That does not mean we can take away all triggers, right? I can't take away the fact that you need to learn and go into a learning environment. So, but I can think about how we do that. So I can make those learning situations super small, heavily reinforced, build confidence and success, and then build you up over time to tolerate a longer and longer learning environment so we can get you back in school. So again, those are all environmental modifications that help us think about that. And then I'm going to teach replacement behaviors and skills. Hopefully that's also going to blend towards communication over time, but where the communication comes in really depends on the individual. So behavior is communication, but I can't always start with teaching you communication to reduce your problem behavior. So we have to think about that carefully. And then extinction, we really want to make sure we're changing how we respond so that our reactions are not reinforcing the challenging behavior that we're trying to reduce. Because if we're reinforcing the challenging behavior while we're trying to build the other skills, it takes a lot longer to get somewhere. So we have to consider that component. And that's not punishments. That's just really trying to reduce the reinforcing method. So how we respond to a behavior might be more therapeutic, quieter, calmer. It may feel a little less supportive. So like when we, the young man with the trach, when we go in there to replace his trach, we are kind and we try to be supportive, but very quiet, not a lot of eye contact, but the touch is gentle and, we're not, we don't have to jerk around or be mean to him at all, but we just have to be real quiet and careful in how we interact. And that is because he really likes everybody to talk and everybody to be wild. And he will chuckle through that. When we do it really quietly, he's like, that's kind of boring. So our goal is to bore him into having better behavior. And then we want to make sure we're reinforcing the behavior we want him. So we're going to, for him, we're going to reinforce lots of, once we get him stable and he's moving forward, we're going to reinforce all sorts of positive interactions and good things. And then we're working on how do we help him cope with those transitions and look forward to what he's getting at home and have knowledge of that kind of things. With our behavior management, we can't expect a miracle, right? It takes a while to change this behavior and distressing behavior. And you can't just reduce a behavior, you have to build skills that replace it. So that takes time depending on the level of skills that you're working with and what you need to replace. And different environments are able to support different levels of intervention. So you have to look at the whole context across. And then safety. So we talked about individuals who have really severe behavior that might cause significant injuries to themselves or others. And that all has to be built into how we treat, where we treat, and where this goes.